Very exciting times at the White House. A lot of things happening that are so great for our country. I want to welcome Made in America Week. This is what we call Made in America right here, and they're all here, some of the great business minds, business geniuses. We're continuing our celebration of American manufacturing and American manufacturing, and it's been something very important to us. Made in the USA, made in America. And our tribute to the skill, dedication, and grit of the American worker. We're showcasing products from all around the country that are stamped with the beautiful letters, Made in the USA. Today I'm proud to welcome 3 more great companies to the White House for really a major announcement. You'll be hearing Merck, Pfizer, and Corning. These 3 companies are announcing that pharmaceutical glass packaging will now be made in America. That's a big step. That's a big statement. I'm very proud of that.
Chaos, inefficient system, coupled with a complex federal structure in India, has hit headlines in recent days, making healthcare excellence and innovations questionable in India. Why? Enter Pharma Leaders' world of research and welcome to the iconic and historic 10th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2017. And we are discussing Bullet Healthcare Express. Known for championing the cause for healthcare innovations and raising serious discussions to pave way for a better healthcare by bringing together the finest brains of the healthcare industry under one roof. Pharma Leaders today is India's most credible and prestigious title and a senior leader in healthcare communications. Backed by more than a decade of experience while working with the stalwarts of the industry, Pharma Leaders has always preferred uniqueness of the subject that appeal to the nation and are first of its kind in contents due to our in-depth expertise, research, and Pharma Leaders' repetition over the years. Ladies and gentlemen, Pharma Leaders 2017 annual edition attempts to bring a structural, systematic, and transformative change in the healthcare ecosystems and fixing the loopholes by continuously engaging the various stakeholders of the healthcare fraternity, aptly titled as the Healthcare Roundtable, fixing the healthcare chaos and transforming healthcare delivery systems, as the theme for the historic 10th Annual Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2017. Pharma Leaders, the healthcare research media wing of Network 7 Media Group, is widely recognized and rated by the experts and industry pundits as a credible platform to raise issues of tremendous significance confronted by the healthcare industry. Pharma Leaders' much awaited and prestigious healthcare summit and roundtables bring together the most powerful and influential healthcare leaders of India in one single platform, including pharma companies owners and CEOs, hospital owners and CEOs, healthcare technology companies, social healthcare foundations, senior management from healthcare enterprises, eminent doctors, development financing institutions, institutional investors, to fundamentally address and impact poor healthcare outcomes and find a blueprint for tomorrow's healthcare. Ladies and gentlemen, Pharma Leaders is of the opinion that India's healthcare suffers from quality, quantity, footprint, access and affordability issues coupled with faulty policies of the successive governments. The World Health Organization estimates that India spent about $267 per capita on healthcare in PPP, adjusted terms in 2014. China spent 3 times that amount, Brazil 5 times, European nations 10 times, and the US 20 times. In aggregate, India spends only about 1.5% of gross domestic product (GDP) on public health care. Most countries spend 2 or more times that number. There is an obvious shortage of medical practitioners in India. So also the public healthcare systems, healthcare infrastructure and personnel. Recognizing that existing health systems in the country are hampered by weak funding, infrastructure and skills, Pharma Leaders' idea is to find synergies that can boost the quality of care while saving both providers and consumers precious funds. There are broad consensus that India suffers from an acute shortage of secondary and tertiary hospitals, a significant shortfall in specialist and specialized equipment, and a rigid regulatory framework combined with corrupt enforcement. All of this leads to appalling quality for the medical system in the country. Add to this a hopelessly inadequate feeder system from preventive health to primary care to secondary and tertiary referral, and you have the makings of system that is so completely broken that it may not be fixable without a zero-based approach. Ladies and gentlemen, Pharma Leaders research reveals that India will have a total bed density of 1.84% per 1,000 people against the WHO guideline of 3.5 by 2022. Clearly, there is a huge gap between demands for healthcare in India and supply. These statistics prove the sorry state of affairs, and clearly India needs to be much more concerned. Any modern healthcare system anywhere in the world would have its own share of challenges. Every healthcare system is unique in its composition, adaptability, and flexibility. Pharma Leaders feel that the challenges mentioned above are all addressable and are opportunities in which credible medical organizations can partner and help provide implementable solutions.
First time in the history of the world, one person is going to control the entire world who probably doesn't know what is next step going to be. Why I am talking about Donald Trump in this pharma conference actually? This has a tremendous impact on the pharma industry.
But the bigger issue is that the healthcare in India is ailing and in need of help. Yes, medical treatment has made astonishing advances over the years. But the packaging and delivery of that treatment are often inefficient, ineffective, and consumer unfriendly. Let's fix it. Ladies and gentlemen, Pharma Leaders believe that India is unable to cater to the rising demands of medical facilities across states as a major part of the population continues to reside in remote and hard-to-reach rural areas, suffering and fighting the worst kind of ailments. Despite several efforts, India still struggles with a severe shortage of doctors, especially in the rural areas. We ask you today, is it the lack of healthcare infrastructure, the poor working conditions for doctors in rural areas, or a medical education system that lacks focus on public health, or the lack of government investment in public health service, or is it lack of a political will to address India's most pressing public health issue? We leave this to you to decide. Remember, we can't be mere spectators, and we must respond, and respond with prudency. Ladies and gentlemen, Pharma Leaders is of the opinion that government will need to take a bigger responsibility in solving this issue. We feel that the lack of a political will is the biggest hindrance in translating these solutions into positive results. The dream of a healthy India where every citizen will have equitable access to quality health care is the need of the hour. This means that political leaders and healthcare decision makers will need to work towards ending corruption and focus more on making healthcare a right of every citizen. Pharma leaders believe that advances in digital technologies will create enormous new possibilities and opportunities. The wise will recognize and ride this trend. Those who ignore it will do so at their peril. As healthcare organizations face unprecedented challenges to improve quality, reduce harm, improve access, increase efficiency, eliminate waste, and lower costs, innovation is becoming a major focus once again. Under our present system, just doing our best or working harder will not be enough. The healthcare industry is on the brink of massive change.